Boots on the ground is a military term. It is used to convey the belief that strategic success can only be achieved through the direct physical presence of troops in a conflict area. It is the idea that presence makes prominence. Like in the military, God has boots on the ground, people who walk in His footsteps. For centuries and to this day, the church and faith-based organizations have provided healthcare around the country, often for the most undeserved and impoverished communities. About 40% of healthcare services in the country are provided by faith-based organizations. This week, Boots on the Ground highlights the church's historical involvement with healthcare.
Jesus commissioned us to go out, teach, preach, and heal. And this commission was to all of us Christians. So, and we are all gifted in different ways. And we all can serve in different places. But when it comes to health and healing, we are the boots and the feet on the ground. And we shall go anywhere. We are exposed to a lot of risks. Think about COVID and all the exposure we had. With very little protection, faith-based was some of the best treatment centers. We dare, to face whatever it is, and because we have faith and trust that we are serving an important mission, but we also trust God will provide and God will take care of us.
The history of healthcare is a larger reflection of who we are as a nation. It includes advances in science and technology, but also touches on the more universal themes of love and compassion.
The church has been health, service, and education for many, many years. In fact, way before government came into being. We are talking about 100 years and plus. So, and we got into this space as an obedience to the Great Commission. It's part of, ministering to people, empowering them, but also meeting their social and physical needs. So, the gap that we feel is that health service needs are everywhere in this country. Today and moving on, and no one player can ever be enough. So we fill in the gap. We complement government, we complement the other players, private sector, NGOs, but as faith-based, one critical component is that we are driven by love and compassion. We are not there because it's business. So that's why you find faith-based were in the most remotest places where people had least access. In fact, they never knew of anyone else. And they were venturing into services that did not make any business sense. And that's our commitment. But over the years, we found the needs and gaps are all over. When people need a specialized service, they are trying to move out of the country, which is very expensive and literally impossible. So what has happened? Within faith-based now, we can do even very specialized eye surgery service to rehabilitate people so they can see. Those who have major visual challenges. We are doing open heart surgery. Today, the leading provider of open heart surgery for children and adults is a faith-based hospital. Area are affordable compared with the market rates. If NHF, there's a time they used to pay 100%, and you walk in, get a service. There is a service all over the place. So, and then communities where children cannot get immunization, they can get basic family planning services, antenatal care, deliveries, faith-based are there. And there's a commitment to continue expanding and reaching out where services are least covered. But we also want to do this in a sustainable way. So we continue also in increasing presence in urban areas because the need is huge, the populations are growing, and the facilities available are not adequate to meet all the needs. In addition, we are in the supply chain of giving very high quality medicines. Mission for Essential Drugs and Supplies is owned by CHAC and the Catholic Church. And it was started so they can make sure medicines that are affordable, that work, that you can rely on, can be accessed by anyone, anywhere. So whether you're in the farthest end of the country, you buy that medicine at the same price as a person in Nairobi. So we promote access. And we have a laboratory that is world class, accredited by international organizations that provides quality analysis for medicines to make sure that they actually what they're supposed to be and they work when you take them.
Christian Health Association of Kenya, CHAK, is a national faith-based organization of Protestant churches, health institutions, and programs from all the counties of Kenya. They have been providing quality healthcare since 1946.
One thing that you have to realize that at the inception of these facilities, when the missionaries came, one important area of concern was health. And so they did establish mission hospitals. And in those mission hospitals, they wanted to meet the spiritual need and the physical need. Now, for us to be able to meet the spiritual need, each and every facility has a chaplain. And this chaplain is tasked with the responsibility of reaching out to those who come to our facility so that they are nourished spiritually, they are encouraged scripturally, and also we are able to pray with them. So in our facilities, we can say that we meet the soul, the mind, and the body.
According to the General Secretary of the Association, Dr. Samuel Mwenda, the mission is to facilitate provision of health services through health systems strengthening, innovation, training, advocacy, and partnerships as a witness to the healing ministry of Christ.
And the vision is quality healthcare for all to the glory of God. The strategic objectives towards building resilience for quality health services in this strategic plan are: 1, health service delivery; 2, health system strengthening; 3, advocacy, partnerships and networking; 4, sustainable financing and resource management; 5, strategic information management; and 6, branding, marketing and communication.
The association has launched a 5-year strategic plan, 2023 to 2028, with an aim of promoting universal access to the much-needed quality healthcare in the country.
And this is our commitment to deliver quality health services and that are universal, that anyone and everyone can access. And we have laid out various strategies that we use. We have identified priority areas which are aligned to the health needs in this country, and ensuring that we reach to everyone with a lot of priority on women, children, adolescents, and also the elderly, targeting communicable, non-communicable diseases, including those diseases are not very common. We call them neglected tropical diseases. But we know we need to strengthen the systems for delivering those services. Some of the mission hospitals in our network are over 100 years old, doing this service even with very limited resources in very difficult places. And the commitment is we are here to continue serving Kenyans. But we also provide spiritual services. It's part of a church ministry.
As the Ministry of Health steers the health sector through critical reforms of devolution of health services and strengthening the management of primary health care, advocacy remains a key area for CHAK.
Advocacy to various, we target to various stakeholders. There's advocacy within the programs that we run. Advocacy and as part of the mobilization for people to understand issues that they need to address and to change behavior, to change practices. There's also advocacy to professionals, to health workers. There's advocacy to leaders within the health sector, but advocacy to government, sometimes advocacy to other stakeholders, including our own religious leaders, so that they can pick up some of the issues that are also priority in society and help us in, disseminating messages, promoting healthy behaviors.
The faith-based health facilities are in some of the remotest areas of Kenya where people have least access to health services. areas where people have to travel several miles to get to the doctor. But CHAC is bridging this gap.
Most of our facilities are in the remotest parts of the country. And so by that, we actually attend to the neediest of the society. And so those people who lack finances, who are below poverty level, who can't access maybe government facilities. And so by that, you'll come to realize that we are constrained in one way or another.
These facilities champion services in emerging areas like mental health, rehabilitation for drug and substance abuse, support to gender-based violence survivors, and universal health care at the most affordable rates.
The issue of mental challenge is a global problem or a global challenge. And let me take it from the church which I serve, right from the national level to the grassroots. Because of this challenge, my church is tackling it through various departments of the church, like organizing workshops, reaching out the local levels. And so it's like we have empowered, if they are the Mothers Union Department and other departments, they have been trained. They have attended several workshops, and so that they can now be able to tackle that challenge at the grassroots. And so that is what we are doing as a church, and also that is what we are encouraging as CHAC. We are encouraging our facilities to ensure that they deal with that issue.
We are better off in terms of access to information, sometimes real time. So we are able to see, cases of mental challenges more often, being played out in the media, in our social platforms. But we are also living in times when there are many challenges. We just come from a major pandemic, which has disrupted the world in many ways. We have economic crisis, we have unemployment, we have alcohol and substance abuse. So there are many factors that are causing pressures on families, on individuals, on the young people. And we are living in a very competitive society. And we have all this exposure to all manner of information from around the world. So all these things contribute to pressures that affect our mental well-being. Recognizing is an important point, that we have a challenge, we have a problem, that I have a problem. And the next step is I need help. And then where can we find help? So we need to build, armies of people who can be able to help, first of all, recognize when there are problems beginning in society, in individuals, in our family members, and then be able to refer them to somebody who can offer some help. And some of these may be our religious leaders, our clergy, our counselors, our health workers, or when you have severe cases, then you're sent to psychiatrists or psychologists who are able to offer the professional support. But you also need to pray. Our religious communities have an important role, prayer, preaching, teaching, so that people are encouraged. We don't get in this hopelessness that is pushing us to a lot of depression and mental challenges.
Boots on the ground, people who walk in God's footsteps. Takes a short break. Boots on the ground, people who walk in God's footsteps. According to Martin Kivuva Musonde, the Archbishop of the Archdiocese of Mombasa and the chairman of the Catholic Conference of Bishops of Kenya, the missionary came with what he calls the two books, ready to impact every aspect of our lives.
The role of the church in the health sector
And I realized the early missionary, when they came, that's over almost over 100 years ago, they came with 2 books. I always call them 2 books, maybe 3. The one book was about the Bible. They're carrying the Bible to read about the Jesus who came to the world to save people, but he also talked about the Jesus who came to heal. So they were prompted to begin dispensaries, some health centers, some hospitals today. Others began not only health centers, they also began schools. The early missionaries came ready to impact on all of us. And the church today, be it Catholic or Protestants, many of us run schools, run hospitals, dispensaries, and education institutions. So, and then of course, the main work is evangelization, which is bringing people to understand why Christ came to on earth. He came to save us. As a result, we find ourselves in schools, we find ourselves in hospitals, and many of these now, as we speak, have turned out to be very big centers.
They have demonstrated long-term commitment and gained trust from local communities.
So these are one ways of answering to the needs of our people. If you go to the rural areas, the remotest place where there is a church, Catholic or Protestant, they try to reach out to the needs of the people. And what are the needs? Education, health. And our partnership with the government, this has made it much easier, especially where we go to areas like NHIF, is partly paid by the government when it works, or in education where you get a certain sponsorship through CDF or something like that. Health in particular is of critical moment, especially now, because many are private hospitals and even some government hospitals are almost inaccessible. Medicine is very expensive. By good luck, sometimes we have aspects of partnership with other outside donors or helpers who support our missions. And we want to thank partners who have worked with the church for the many years in the sector of education, in the sector of health. And we can never forget the early missionaries who came really full-hearted. And in particular, they are still there in the institution they began. Some of our schools we know were outstanding. Kabaa years ago, 2012, those years. And yes, that's Machakos. In Nairobi, you know, schools like St. Mary's was started by the Holy Ghost Fathers. And to this day, it still stands out. The Loreto schools, those who came were religious nuns, Mercy Sisters who ran the dispensary, the hospital mater, and they have gone on to a higher notch now. Every year they raise money through public participation. Children walk, or families walk, collect money to help cases of heart issues. And therefore, that's the church we belong. I'm from Mombasa and I appreciate their presence because in many places you cannot access, government hospitals are there, but much as you want to be there, there are challenges also sometimes with the facilities, medicine, and expenses and so on. Doesn't mean we give it free, no, but there's always a cushioning for the church. So I want once again to thank all those who have been part of our journey. The government itself, the partnership we are trying to do today, and asking them to expedite the area of NHIF, that it reaches as many people as possible, and pay their portion of their contribution to us, so that the dispensaries or the health centers or the hospitals don't collapse. Because in that way, everybody will suffer, even the last person.
The faith sector provides spiritual counsel and support, and in some parts of the country are the only or the main providers of primary health care at the grassroots.
We are facing a challenge as far as early pregnancies are concerned, and we will want to encourage the society as a whole to be involved in character formation of our youths, of our teenagers, so that we start taking care of them right from inception. Because a parent has a responsibility of the bringing of the child. The community has a responsibility. Like in the former days, those good former days, you know, what used to happen is that an individual belonged to the society. So we all had a responsibility. But nowadays, it's like nobody cares about these young people, and they have not developed. They are still developing, and so they need someone to hold them by their right hand. So as a church, it behoves us that we, through our teachings, grounding the parents in the Word of God, encouraging them to be closer to their children, and when one also succumbs to such like a challenge, we embrace him and we also encourage him that is not the end of the journey, but God is still at work in his life.
We have a very big population of young people in this nation, and one of the challenges we are finding and needs is in the area of adolescents. They have adequate knowledge about adolescent issues like health, like changes that happen in their bodies as they grow, in their reproductive organs, their reproductive system, but also being empowered and equipped with knowledge regarding how they are able to maintain healthy, keep their bodies well, maintain their education, but when they need to get health services, that they are able to attain them. We are very concerned about many cases of teenage pregnancies that are happening in some of our communities, some of our counties. And as church and church institutions, our strategy is to engage people, young people as they grow, with information, with education, with awareness about their sexuality and health, and the dangers of engaging in early sex, premarital sex, the risks of pregnancy, the risks of transmission of diseases, and how they can protect themselves. But what we feel is knowledge is the most powerful tool, and understanding. But just like human beings need to continue being reminded. So continuous encouragement, continuous education, but also being able to demonstrate good role models in society that they can look up to. That the time will come when some of the other things they may want to engage in, they can, and it will be safer for them at that time. It will be appropriate, it will be timely. So we teach about all those things in our reproductive, maternal, child, and adolescent health.
As the faith-based organizations continue to provide the healthcare services, CHARC is discouraging the idea of any individual who preach against healthcare.
As faith-based organizations involved in health, we believe that all Kenyans should go to licensed hospitals and other health facilities whenever they fall sick. And these are the ones licensed by the Ministry of Health. Our vision is to offer quality health care for all to the glory of God, and our mission is to engage communities to empower them to seek and access quality health care services. We discourage the idea of any group or individual who preaches against access to health care. We encourage all Kenyans to ignore theories of faith healing that tend to ignore science, because science contributes to healing, and through prayer, Jesus heals. We call upon members of the public to be modest and not to be brainwashed. We believe that religion must not act as a catalyst to retrogressive myths and misconceptions that will make our people perish.
They are appealing to the government to support vulnerable Kenyans to access universal health insurance.
I think where the government is supposed to come in is there are Kenyans who are totally poor, indigent, who need to be assisted. And we would appeal to the national government as well to help support Kenyans who cannot maybe have any means of paying that contribution. But for NHIF to be able to pay us, and this is our pain, is that NHIF needs to receive money from us, the contributors. Those who are employed, we know it's mandatory, our money is deducted and sent, but you are saying government also should do the same because it's an employer. And where there are programs that they have committed to support, they need to release money to NHIF, and NHIF needs to pay us efficiently as we serve the people every day, so that we have the money to pay our health workers. Our church institutions, we have to raise money to pay our doctors and nurses and everyone. We have to pay for medicine, we have to pay for electricity, water, and many other things, including licenses that are required. So we are in support of NHIF. We work well with NHIF, but we are only very concerned, constrained now because there's quite a huge amount of money that's yet to be paid. And every day we are seeing more Kenyans who need services, and they walk in and walk out with the medicines they require.
The faith-based health facilities are equally struggling with the burden of pending bills, facilitation of medical equipment, and medicine.
Health services are expensive. You need a lot of inputs that we all buy and pay for. You need a health worker who must be paid a salary. And salaries are not any different. You need to enumerate them according to the standards in the health sector. And health services is a very labor-intensive service. So it needs a lot of workers. That's the biggest burden that the health facilities have. The next is medicines. And those are both. You need equipment, you need supplies for running tests, you have to pay for your electricity bill, water, whatever, maintenance. So there are inputs that are costing every day. So we're able to run them through raising the money, and the money we collect from those who receive the services. And we encourage people to be part of insurance schemes like NHIF, because you contribute a little amount when you're able, and when you need a service, you can access even very expensive services. But then, so the hospitals and health facilities would provide the service, depending on this insurer paying, so that they can also pay the one who supply drugs, can pay their workers and electricity and so on. So, because even what they pay is very modest, barely meeting cost, sometimes it's below cost. So when there's a bit of a delay, then you find yourself you're in cash crisis. You never quite build any reserves that say that I have a reserve, a pot of money somewhere I can go to, to get money to pay for this, because I can't function without medicines. So our appeal, because we are committed to being part of the solution for universal access to quality health services, is that when we get into a contract with NHIF, with these other insurance providers, please, we do our bit very faithfully. We do offer quality. We submit whatever documents are required. You're okay with them, please pay us as per the agreement, so that then we can ensure that services are available every day for your clients as they come.
We mostly depend on NHIF and other financing facilities to run our activities. And so when there is delay in the disbursement of what is required for the work we've done, then you find that our hospitals do struggle.
As the faith-based health facilities around the country continue with the work of caring for God's children, everyone who visits the hospitals and clinics can simply say they are indeed boots on the ground.